Good evening everyone and welcome to today's meeting of Health and Wellbeing Committee on Monday 21st of October. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photography, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be vacated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you have left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. So, moving on to the first item, do we have any appointments of substitutes?
Thanks, Chair. No, we haven't got any substitutes, but I've got apologies from Councillor Naz Hussain. I understand he's not well.
Thank you. And do we have any declarations of interest? Okay, great. I have an interest to declare, if that's okay, as the Chief Officer of a disability charity based in Worcestershire. Any public participation? Okay. I just wonder if we could just go through the minutes, if that's okay, of the last meeting. Has everyone had a chance to have a read of them, page by page? Are we taking that everyone's in agreement? Okay, thank you. And just before we go on to agenda item number 5, I just wonder if we could do a bit of a change of what we normally do, is if we could go round the room and if members could introduce themselves and which political group they belong to, simply because I'm just thinking of inclusivity and accessibility to those residents who are listening in remotely, would need to know if they're visually impaired who's speaking. Has anybody got any objections to doing that? No? So if I start off and we'll go around, that's okay. So I'm Elena Round and I'm a member of the Green Group.
I'm Elaine Wilmore, Labour Party.
Councillor Lynn Denham, Labour Party.
Richard Udall, the Voice of St John's and Labour and Cooperative Party.
Conservative Sadiq, Labour Party from Fordred.
Councillor Ed Kimberley, hoping that the banner beneath my name says Labour Party.
Councillor Sarah Murray, Liberal Democrat.
Councillor Alex Kinnersley, Green Party.
Councillor Steve Cockram, Green Party.
Councillor Neil Lawrenson, Green Group.
Cathy Davis, Interim Head of Finance.
Sal Khan, Interim Director of Resources and Finance.
And Lloyd Griffiths, I'm the Council's Corporate Director for Operations, Homes and Communities.
Tom Mountford, Head of Homes and Communities.
Thank you all very much. So agenda item number 5, setting of the budget for 2025-26.
Thank you, Chair. So this report is the next stage in the budget timetable for setting the budget for the 5 years from 25-26. The report gives you a bit of background. In February 24, we set the budget for 24-25, and at that point in time, we had a gap in the budget of 1.3 million for the 25-26 budget. We then talk about the service budget, and this is asking members to consider any efficiencies or service changes that could ultimately reduce the budget pressures for 25-26. I then talk about any key projects or capital expenditure linked to this committee, and the details are enclosed in the report. And then finally, I point you in the direction of the city plan and share a copy of what's left in the city plan to deliver. That's on Appendix 3, I think. Happy to take any questions on that.
Any questions? Councillor Denham.
Thank you. I've got a couple of questions, one specifically related to this committee and another a more general one. So in paragraph 4.5, the active travel plan and the funding associated with that. So it's got the sort of the spend to date, leaving 12k to carry over into the next financial year. So does that mean that we are at risk of, or we will be losing the officer, the active travel officer?
I don't know what the plans are, but the original bid, the 100k, was for 2 years, fixed term active travel officer. I don't know what the plan is after that. I can find out and report back to you.
Yeah, I think what we probably need to clarify is whether or not that £100,000 came out of the town investment plan, or whether it was a separate sum of money approved by the council through its own budgets. I am aware, in terms of the town investment plan project, there is an underspend, and there are plans being developed at the moment on how we can possibly spend that underspend, which we'll bring back to members at some stage. But I think we'll probably have to take that one away to clarify, Councillor Denham, if that's okay.
Yeah, that's fine, because I think, this committee, what's been achieved with the active travel has been really good. So I think we need to kind of understand what its future is, and yeah, what the ongoing work is and what the ongoing funding is to maintain that progress kind of thing. That would be really helpful. Thank you. And then my other is completely unrelated to this committee, but because so it's Appendix 1, the list of capital, the capital programme and the schemes that are there. It's the first of the UK SPF ones, the wayfinder, signage and totems, I think that stands for. My understanding was that project had stopped, was not going to be carried forward. So I guess I'm kind of asking officers now, is that the case? And therefore, is that, a funding stream or a savings pot that we can put back in?
This report is at Q1, so things may well have changed since then. So this would have been the view we took in July. If it has been changed, it'll be wrapped up in the whole UK SPF package, which I think is coming back to a different committee.
I think it'll be part of PED,
Yeah,
Policy and Economic Development.
Yeah. I know there's plans for all the UK SPF money. This isn't the latest report. There's a Q2 report being prepared at the moment.
If I can put it on your radar,
Yes.
to double check. Thank you.
Do we have any other questions at all? Silence. Okay. Are we happy to accept the recommendation? Oh, sorry, Councillor Cochrane.
Thank you. Just in terms of the suggestions for controlling the budget for the medium-term financial plan, is there a deadline for considering those options? Suggestions that affect things under this committee, do we need to sort of suggest them in the interim and they come back to this committee at the next meeting? Just wondering what the next steps are in that.
I don't think they formally come back to this meeting. I think the next report I prepare for you is what we think the budget is going to be, and give you a draft version of that, subject to funding notifications. I think you passed the message on through your group leaders.
Thank you, Chair. This report is really warming members up ahead of the January committee. So I think in time-honoured Mr Flynn fashion, I think what he would be asking is that if you and your groups can consider any plans or proposals that you might have, whether that be for investment or whether that be for saving, that you consider those within your own groups. We are here to answer any queries or support you with any thinking that you may be having. And really, what we I suppose we don't want is any surprises at January committee. We've had that in the past with some capital projects which have been quite difficult to manage. So as officers, we are here for any ideas that you might have prior to January committee, so that we can support you on the evening to have that debate.
Thank you. So just so I'm sure that, so we can go back and talk to our respective groups and then come back to officers, so in time ready for January, you're well prepped, and we can then discuss what's going to happen then. So you're not asking for anything for tonight, so we can go away. Right, okay, thank you. Any other questions, or are we happy to go straight through to the recommend? Oh, sorry, Lynn.
I mean, just to follow up, therefore, that the answer as to what the ongoing funding is for active travel is very relevant to what we may or may not want budget, you know, as to what next year's budget is, and whether this committee actually would be wanting to try and put a bid in, so to speak. Thank you.
Thank you. Can we just have a quick show of hands that we're happy with the recommendation? Yeah, thank you very much. So if we move on to the next item, which is item number 6, the Q2 performance report. Who's... Okay, thanks.
Thank you, Chair. Chair, I won't spend too long on the performance report. It's the usual format, and this is for Q2. Members will recognise the key projects and the key performance indicators. In terms of key projects, 2 out of 3 are showing green, with 1 amber, and we've got a report this evening on how we're going to spend the new allocation of household support grant. And there's also quite a bit of narrative within the KPI relating to that project as well. And then in terms of the key projects, probably more red than we would like, but again, there's plenty of narrative to explain why we're in some of those situations, and a couple of green there. Particularly pleased to see that in terms of the green around the access guide, we're at our highest number since we began measuring. And it's great to see Onside have also reported their second highest number of young people supported during Q2 as well. So I think, Chair, there's probably enough officers around the table to be able to hopefully answer any questions members may have, but probably nothing more to say than that.
Thank you, Lloyd. Do we have any questions at all? Councillor Kinnersley.
Thank you, Chair. I just wanted to ask one point about the Beryl Bike scheme, if I can. So it's been raised, although I think generally we have sort of in support of it, and it's great to see it being used widely. I have had some feedback that whilst it's a good thing that people can just hop on a bike and use it, the downside is that people often aren't equipped with reflective glare, bike helmets, and they may not always be in the best state to be on a bike. And I've had some feedback from residents that they are experiencing some kind of consternation with seeing people on Beryl bikes and riding on pavements, and just generally kind of maybe not kind of riding bikes as one would hope. Difficult to know how we're going to tackle that, but is there something that we could at least raise with Beryl just to sort of say, is there anything we can do? I suspect it's not an unusual situation, that they say that, you know, it means a lot of people aren't jumping on bikes without bike helmets. But just to explore if there's anything that can be done to try and avoid the sort of scenario of somebody becoming a cropper on a Beryl bike. Thank you.
Chair, I'm aware there are comms around, hiring a bike, and I'm also aware that I think you have to sign a disclaimer in terms of how you're going to use it. I suppose as to what extent the council can and should get involved in what should be a responsible behaviour when you're using a bike. So I think all I can do, Chair, is commit to taking that away and speaking to David Sutton about it to see if there's anything we can do, Councillor Hindley.
Thank you. Any other questions? Councillor Udall.
I'm looking at page 25 on the paperwork, the exercise by prescription referrals. I know it was a very limited scheme, but this is the best will in the world. It's a total failure with the amount of people who've taken up the project. I just wonder if there's been any explanation of that to explain the problems, whether we are getting the cooperation we want from GP practices and whether the information is flowing to the patients to actually make referrals. Because we're not looking good at the moment, and I am concerned about that.
Thank you, Chair. There's a number of organisations involved in this scheme, so it's not a city council scheme per se. There are 3 or 4 organisations involved in it. The feedback I've had ahead of committee, because I was conscious that we tend to get a question about this, is that as a direct comparison, the Malvern scheme is getting more numbers than us. You know, when you think of population numbers, you start to scratch your head a little bit, don't you? So what I'm being told is in the next couple of weeks, we will have completed training and signing off an additional number of health coaches who are referrals and able to actually get involved in the scheme. We believe there's more we can do around communications and pushing the message out. And some of the more local, hyper-local work we've done, it seems as though some of those groups or organisations that should be aware of it aren't aware of it. So there's definitely something around communications. But hopefully as well, increasing the number of health coaches will help as well. So I'm hopeful, Councillor Udall, in the next couple of quarters, we should see an uptick.
Do we have any other questions? Councillor Denham.
Thank you. Well, the first is a comment, and that's around the accessibility in Worcester and the Inclusive Worcestershire Leaders Award, because I was privileged to be invited along with Councillor Norfolk, and we actually collected the award last Tuesday. I've got a badge to prove it. So huge thank you to officers who've done the work to, to achieve that. And it was really quite an interesting meeting that we went to, because it was an opportunity to hear from other employers who've embraced equality and diversity and inclusive employment. So I think there'll be some kind of more interesting conversations to pursue with them as well. So yeah, thank you to officers, and thank you for the invite and the opportunity to celebrate what this council has achieved. Then a question around active travel and the Beryl bikes. And I wondered, is there a bay? Well, I was particularly asking about King George V or Brickfields Park. But in fact, have we got bays in all our parks? And I guess the particular reason that the KG5 came into my head is that I've had communication from residents that we don't actually have a bike rack in the park, which I find a tricky, I find surprising. It is a big park with lots of different entrances, but you've checked it out, have you?
Yeah, I think as I've checked it, there's no bike rack there. The centre there you're talking about.
There's a community centre in the middle of KG5 Park. I mean, KGV, KG5, Brickfields Park. It's all the same place.
Yeah, I've had communication as well from residents, councillor, about that, and I haven't been to have a look at myself, but I've heard it from quite a few that say there's no bike racks there to store your bikes, so it's something that we need to look at.
So can that be, yeah, I mean, Lloyd, in terms of the parks? And
Again, absolutely. We'll feed that back through to David Sutton tomorrow, who's leading on the project. And I'd encourage all members. I had a conversation outside of the committee setting tonight about another location potentially. So I'd encourage members that if you do have locations that you're interested in or concerned about, then please feed those through to David. But those ones that have been raised this evening, we can feed back. I do know in terms of KGV, not specific to KGV, but there is a bay relatively close by, just outside the cemetery, outside Astwood. So that's probably within a couple of minutes walking. But it's not a KGV dedicated bay. But yeah, we'll absolutely feed those through, Chair.
Thank you.
Yeah, I think I would say that what has been interesting about the Beryl bikes is the now they've been rolled out for a number of months, is the amount of residents that are contacting all of us to say, can we have a Beryl Bike Bay here? So I think that's testament to the success of the Beryl Bike scheme, but also it's making residents more aware that when they're riding their own bikes, where can they store and safely secure their bikes when they go into community centres and other public buildings. So I think it just goes to show how successful the Beryl Bikes has been, and the fact that I'm sure we'll be coming back to this committee soon, seeing if we can get more bays installed somewhere else. Councillor Murray.
Thank you, Chair. So just for the record, I did have a conversation with Lloyd earlier, but there is still no bay in St Nicholas Ward. It was suspended a few days after it was first launched, and we're still waiting for a replacement bay. And I'd just like it to be on record that I am chasing it. I am trying to get that fixed, and Lloyd has said he will speak to David Sutton about that as well. Thank you.
Thank you, Councillor Murray. I think as part of the Active Travel Steering Group that we are desperately trying to get that sorted out for you over in your ward. It's been a long process, hasn't it? But I think the officers are really working hard to try and get that resolved for you as quickly as possible. Any other questions? Councillor Kimberley.
I've got one of my many classic rookie questions to ask, if that's all right. I'm looking at the number of rough sleepers supported into accommodation. Obviously, it's wonderful to see that we're staying over target and actually, overperforming in helping people get out of sleeping rough. What I was wondering is whether we have data or whether we are capturing data for the number of those people that we have helped off the streets and then into more long-term accommodation. The stats seem to show when they have been taken into short-term accommodation, but it doesn't seem to capture, from what I'm seeing, anything that happens to them subsequently. Is that something that is captured and recorded? Thank you.
In short, yes. We did do some work to simplify the performance indicators that we reported through to this committee. Previous years we had a number of different performance indicators, I think one of which may have captured move on into long-term accommodation, but it is something we track because we are acutely aware that short-term accommodation can subsequently lead back to rough sleeping, so our focus is very much moving people into longer-term, more stable accommodation. So that is something we capture and track, and where people do subsequently become rough sleeping, we'll then see if there's something we can learn from that, if that's because of losing short-term or long-term accommodation. So yeah.
Any other questions, Councillor Cochrane?
Thank you, Chair. I'm asking a question about the number help through household support fund. So there seems to be a pattern that Q1 is low in uptake. I wonder if there's any particular reason why Q1 seems to be low, both 2023 and 2024. And then my other question is about sort of demographics of those that are supported through it, as to whether we collect information through the DWAS scheme as to, for instance, like age group, like what proportion would be pensioners compared to families that we're helping, and similarly with Citizens Advice Bureau, whether we get any demographic data from them.
Well noted on the short take-up early on. Generally, that's because it's the start of a scheme, so it takes some time to mobilise. So, for instance, with the current household support fund, which I'll talk about later, that scheme's not yet mobilised because we haven't brought it to committee for approval to get that through. And I think last year was a similar position. We got late notification of the scheme being available, so it takes some time to mobilise. There is an error with this performance indicator in that in last year, Q1 did record the number of households, and then it subsequently recorded the number of individuals assisted. So we need to revisit that to amend those figures, so they are inflated. But the total number of households supported last year was 5,220, which was 12,192 individuals. So we'll adjust that. In terms of demographics, we do capture some information I'd have to check exactly what we capture for each element of the household support fund, but generally it's dictated by what our reporting requirements are back to county and then subsequently government. But we certainly know households, individuals. We previously had to capture older people. I think we still capture that, but I'd have to double check. So we do capture some, and if there's, but not necessarily every element of detail around demographic information.
Any other questions? Okay, I just wanted to add actually that I'm really pleased that we've now got details on the household support fund. We've got more data for us to have a look as to how many people, how many households this money is. It's only for 6 months, but it's useful to have this data so we can make sure that we're trying to get to as many people as we can and that the money is getting to the right people. I just wonder, have you heard back from Citizens Advice Bureau and the Food Bank about how their allocation has gone?
Yes, for the past quarter, I think the CAB received their funding later on. There were delays in allocating that funding. The last quarter's numbers was 182 households supported. The food bank was 1,052 past quarter.
Thanks, that's really useful. Any other questions? Oh, Councillor Udall.
I'm trying to find a hook to hang this question on, and I'm doing it through again the item exercise by prescription referrals. I heard last week in another place of a huge increase in problems of women complaining about harassment and abuse while out exercising, especially either running or at sports centres. And I think it's been estimated, I can't remember the statistic, but it's well over 50% of women who go out running get abused while they're out running. And an equal number of people feel harassed in sports centres. That's overall, not just Worcester. I do wonder whether it's something which we need to look at I know it's potentially an area for another committee, but it's as if it's a bar to participation. That's something which we need to examine and look at to see what we can actually do. And there's been some talk about a public space protection order which would enable women to be protected while out running. And I wonder if there's something which I don't expect an answer now for, which Lloyd is probably grateful for, but it's wonder if it's something which we can examine and work with Public Health at County Hall to see if it's something which we can do something about. Because if it's the case, and is a problem, it certainly is a bar to participation, and it's something we should consider how we can tackle.
I think it's a good point, Councillor Udall. Yes, definitely. Any officers want to comment?
Chair, at Communities Committee, in a couple of weeks' time, we've got the annual Freedom Leisure report, so that will be an ideal opportunity for a member to ask a question about the issues relating to in-centre issues. And in respect of women running in the open air and sort of potential abuse being received there, my initial reaction will be I'm scarred with PSPOs on a number of grounds. I'm not sure that would be an appropriate tool for it, because I think it would be very, very difficult to enforce. But I think the principle of what Councillor Udall is saying would be absolutely supported, and I'm sure we could have a conversation with the county council around whether there's some joint comms we can do around it. Absolutely.
Councillor Kimberley.
Another rookie question for you. I'm looking at page 4 of the report, and I'm looking at the number of ICS health initiatives supported, which obviously is a metric sort of measuring the number of initiatives we're supporting. Some of them seem to have metrics that give us an idea of the uptake. Do we have any data about the uptake on smoking cessation clinics? Are we succeeding in reaching people with those?
Chair, I think that's a relatively more recent one. I think that we've started to support. I'm sure there will be. Numbers that we can perhaps share with members as part of a follow-up email. But obviously, the KPI relates to initiatives supported, not number of people. But I'm sure we can look into that and get a note out to members following committee.
Okay, any other questions? Okay, in that case then, are we happy to accept the recommendation that the Health and Wellbeing Committee notes the Council's Q2 performance for 2024-2025? Show of hands, please. Everyone happy? Thank you very much. Next item on the agenda is the Worcester City District Collaborative.
Thank you, Chair. Chair, this is the 6-month update on the work of the collaborative. I'm conscious that the last time members had this report was pre-election, so there may be some new members in the room. Very simply, the collaborative is a multi-agency group. It's got public agencies, statutory agencies, and community organisations, all with the aim of trying to deliver the health and wellbeing improvements for the city. It's sort of place-based and very much linked to the County Council's health and wellbeing strategy. The three priorities for the collaborative have remained the same since we commenced. So it's tackling loneliness and social isolation, providing the best start in life, and targeting engagement where inequality or deprivation is linked to health outcomes. And each year we revisit those through a strategic assessment meeting where Public Health will present us with a whole host of data to make sure that we're still targeting the right themes. Just in terms of activity over the last 6 months, or things that we wish to bring to your attention, one of the things that we've benefited from since we started was the appointment of a District Collaborative Programme Manager. When we set out, it was very much myself and Tom and Warwick trying to do the best we could in terms of running the meetings. But thankfully, through public health money, I think it was Best Start money, we were able to appoint an officer to undertake that work, undertake that role for us. Unfortunately, that role comes to an end in March, subject to us getting any more funding. Now, Public Health have signalled they won't be able to provide the funding. So what I have done is gone back to the ICB, because the group is sort of premised out of the new ICB arrangements and said, look, there is a gap here, and without that role, we would struggle to be able to do what we're currently doing. So I'll keep members updated on that one, and I'll keep driving to make sure that there is continuity in that post. Just in terms of an update from on-site advocacy, so again, those members who were around in 2022 will remember that this committee very gratefully approved funding of £160,000 to extend the Act on its service for 2 years within Worcester City. And on-site advocacy were the commissioned organisation delivering that service. And that's very much around providing children and young people with support around emotional and mental well-being. So the money this committee approved is sort of focused around young people settings, and you'll see there in paragraph 3.4, Our Lady Queen of Peace, St Clement's Primary School, and Worcester Sixth Form and Howe College are where the support has been provided. There are some charts and graphs in paragraph 3.5 that show some of the key numbers over the last period. And again, I think one of the things that we've been asked to point out is that certainly in the younger settings, the amount of contact in time is increased due to the sort of whole family approach that's put in place to support young people. And the main area of focus is around supporting children and young people with anxiety. And again, it's worth flagging that that funding is due to end next year. So again, we will update members on any plans around that. Paragraph 3.8 then just talks a little bit about the activity of the collaborative since March. So we've met twice. Good representation we continue to receive, and we've listed there a number of presentation and topics that we've discussed, and we further developed plans around the 3 priority areas as well. So providing the best start in life, activity around that has included Healthy Start, supporting eligible families to access and uptaking Healthy Start cards and vitamins. We mentioned reducing childhood anxiety, better physical outcomes, and we also ran as a council a small grant scheme during the summer around free play activities. Loneliness and isolation, we've worked with the VCSE to understand the barriers to engagement. There's been some work around establishing a consistent referral process around training and awareness for frontline staff. And interestingly, over the last couple of months, there's been a real focus on shift workers and the hospitality sector and supporting them to be able to access health appointments better, given their working hours. And then lastly, around health and inequalities, the focus remains on how can we support our more deprived communities to better uptake health opportunities, both appointments and those sort of proactive opportunities as well. We've continued to support promoting the Your Health, Your Worcester van, and as has been already mentioned tonight, the smoking cessation clinics as well. 4 of those have been run in our community centres across the city. We next meet on Friday, so that'll be another opportunity for us to get together and review where we are in terms of our key priorities. And then lastly, just to point out, this will be the first meeting, that will be an extended meeting. Healthy Worcester was a key group that ran in the city previously. That has now been drawn to a close, and we will sort of pick that up and welcome Healthy Worcester members to the afternoon session of the collaborative. So there'll still be that opportunity twice a year for Healthy Worcester members who don't sit on the collaborative to come and sit along like-minded colleagues, learn or understand what's going on, and have that opportunity to network and discuss as well. So I'll stop there, Chair.
Thank you, Lloyd. Do we have any questions? Councillor Kinnersley, then Councillor Lawrenson.
Thank you, Chair. I wonder if I could ask about a couple of areas. With regard to on-site advocacy, I'm just wondering, there's 2 schools that are involved. Why those 2 schools, and to what extent can the work be rolled out to other schools who I'm sure would be interested in having the benefit of that work? And then secondly, the other thing I wanted to ask was about 3.15 on page 31. I just wanted if you could just clarify the health and inequalities activity. It says increase the percentage take-up of health checks, and it mentions a figure of 20%. Does that mean it's gone up from by 20%, or is that the target to go up by 20%? And in which case, how much has it gone up by? If you could just sort of clarify that, thank you.
If I start backwards, Chair, I'm reading that as being the aim is to increase it by 20%, and I'm not aware. I've not got the information at hand as to how we're doing against that. Given that it's pretty early days, I would suggest it's probably on the lower side. Just in respect of the work that on-site are doing, the money, Councillor Kinnersley, that this committee approved was to extend the project, to broaden it. So it's an already commissioned service from the County Council that on-site have the wider contract for. So actually this is about additionality, so it's already taking part in the community.
Thank you, Chair. Thank you, Lloyd. There's so much good work that's been captured in this report. Makes me proud to be on the council, even though I've had nothing to do with the work that's been carried out. So all the more reason to, raise concern / question about funding for the collaborative programme manager, which you gave in your verbal summary. I appreciate that you're trying your best to renew that funding beyond March next year, but isn't there a role for us as councillors to make that plea as well? The collaborative, I quote, acts as a vehicle for delivering Worcester City Council's health and wellbeing priorities. The reason we became councillors is to make people's lives better. And then potentially in 5 months' time, we will lose money that has been paying for someone to coordinate that health and wellbeing work. So rather than it be on your shoulders as an officer, shouldn't we as councillors, either through chair, vice chair, or collectively be saying, can we renew that funding, please? Because these are our health and wellbeing priorities. And to make people's lives better, we need more funding. So I thank you so much for your efforts and your requests for continued funding, but I just wonder whether we as a committee should be doing more. Thank you.
Thank you, Councillor Lawrenson. And when this paper came to the CAP meeting, the Chair and Vice Chair have kindly agreed that if I can't get any traction, they will pick that up on my behalf, on behalf of members. And I know the political leadership as well would be hugely supportive of getting involved and pushing that message as well. So I've got no concerns around the lack of member support as and when we need it. Hopefully we won't.
Thank you, Lloyd. Any other questions? Councillor Wilmore.
Yeah, if I could just echo that, because we do feel that RIS's role is fundamental to driving the collaborative forward. But given the other stakeholders who are represented, you know, I think everybody needs to share the load in terms of funding that post, that it is a community-driven agenda for the whole of Worcester. And I think it's you know, Lloyd's voice primarily, but our voice as a collective who are driving it, but it shouldn't be necessarily on our shoulders to fund that post in isolation. I think we need buy-in particularly, and that's what the ICB is there, is to coordinate the health activity across the whole city. So I think, you know, broad shoulders need to probably take some of the, I was going to say the word burden, and that's not the right word, because it's a, you know, it's a really important post, but it's not just up to us to fund it.
Any other questions? No? Okay, yep. So are we happy to know that the committee knows the contents of this report? Yeah, everyone happy? Great, thank you. Next we go on to item number 8, the Household Support Fund, Tranche 6 allocation.
Thank you, Chair. So I think all members of the committee will be fairly familiar with the Household Support Fund. By now it's been running for a few years, and we've had various different extensions to that fund. The latest round tranche of funding ended on the 30th of September. We received £168,543 from our core elements, with an additional £10,000 £10,000 awarded for food. That was allocated as set out in table 2.4 of the report. Final numbers for that support, so that met a cumulative total of 2,702 households, and there's a breakdown of how that was distributed through the various different means and how many households benefited from that. As we only had confirmation of the Household Support Fund being available for 6 months in the last tranche, we took the opportunity to allocate a proportion of the UK Shared Prosperity Fund to provide some mitigation in the event that the Household Support Fund came to an end, and that came to this committee in January this year. The table in 2.6 sets out the areas of spend for that allocation. It was £100,000, and that was broadly in line with the previous Household Support Fund allocation. That has to be spent by the end of March next year, and we propose to continue to allocate it in the means that was agreed by this committee in January. We've subsequently been advised that there's an extension or a new scheme, Household Support Fund Tranche 6, which takes effect from the beginning of this month until the end of March. Again, all of that funding has to be allocated by the end of March next year. And there's quite a bit of detail in the report in section 3 around what's eligible, what that can be spent on. And there's some further guidance for anyone that's interested in the detail behind each of those elements. So the proposal that's put forward in the report today is to allocate the funding as set out in 4.5 of this report. In this tranche, we've been allocated a total of £188,543 for Worcester. So that's made up of the 168 of the core allocation, and then £10,000 allocated for food, with a further 10,000 allocation for food or warm spaces to be used sort of flexibly as we see fit. There is a further £30,000 which will be allocated by the County Council to each district area. That doesn't come to the District Council, but to the Worcestershire Advice Network, but to be used within the district. So each district will receive that additional allocation. So the table in 4.5 sets out the proposed distribution of the funding. It's broadly in line with previous schemes. We know that we've got the means to be able to deliver it quickly and efficiently. We've used these means because they're existing schemes that operate. So in the event that the Household Support Fund comes to an end, people will still come to the right places to access help and support. The one main change is the proposal to allocate some funding towards volunteering community organisations. And the reason we are proposing that, because we've got an additional allocation from the UK Shared Prosperity Fund for this 6-month period. We don't propose to allocate any additional funding to the food bank other than the £10,000 that's specifically for food. So that would make a total allocation to the food bank of, I think it's £60,000 during this 6 months, which is more than we've allocated in previous tranches of the household support funds. But it frees up some ability to use that funding in alternative ways. I'll finish there and happy to take any questions.
Thank you, Tom. Do we have any questions at all? Oh, Councillor Lawrenson.
Thank you. Yeah, I've got a scripted question, but I just thought came to my mind about how we've normalised food banks. Just wanted to make that point public. You know, we're trying our best to plug all these various financial gaps and help people stay afloat. But last 14 years, man, you know, what damage has been done. And yet here we are, normalising part of that narrative. But anyway, I'll get to the question. So as per the winter fuel payment motion that was proposed at full council on the 17th September by Liberal Democrat councillor, what are we doing to help pensioners on low incomes? The motion proposed by my colleague stated that the council would seek methods to mitigate the shortfall for those pensioners on low incomes who will not be eligible to receive winter fuel payment, and connect them to organisations who can help. So what are we doing to help pensioners because the winter fuel payment has been withdrawn?
Chair, given the amount of time between the council meeting taking place and where we are this evening, we're still working through, you know, on what it is we as a council and how we can respond to that. There are a number of existing mechanisms where we're already supporting individuals to help with their sort of their daily costs, but we will respond to that council motion in due course.
Thank you. Anybody want to come? Any other questions? Councillor Cochrane.
Yeah, I mean, along that same sort of theme, really. There's a sentence that's changed in this allocation under spend to save between the previous year and this current preferred option, which concerns me a bit, because if you look at the table under 2.4, I think it is, actually both 2.4 and 2.6, spend to save, it's got an additional sentence saying to include over 65s and to cover rent where utility bills put the households at risk of homelessness. And that's been removed in this new table. Why?
Yeah, that's not that it won't be used. It's to make it broader, essentially. So the spend to save scheme would still be available and accessible to over 65s as it would be for under 65s. I think how it originally came in to being in the spend to save scheme was specifically referencing it, but it's always been a universal option. So anybody that's presenting as homeless or at risk of homelessness, we would use that scheme towards that. I think I suppose on both of those points, the way that we've structured the areas of spend mean that they're all universally available. So they're available for older people as well, not specifically set aside for them. So we have energy vouchers which are available for over 65s. So it's not to mean there's no intention that anything's been taken away. It remains available to them. The intention is to broaden the scope of that spend to save scheme, hence it being slightly broader worded.
Can I just ask?
It's a relief.
Sorry, did you want to come back?
Fine. I mean, it's a relief to hear that it's not that something's been removed. I guess the fact that it was in there before, it's one of the things where that puts in black and white some kind of emphasis or priority, and I wonder if that might be a useful thing in this current document, given the full council motion. We don't doesn't have to be complicated to set up new services or anything like that, but just to say, well, coming back to previous points about data collection, if we ask our partners to give us demographic data that so that we know how many pensioners are being helped, or have a line in their service agreement to say, this is a priority for the council. That might come some way towards a simple way to partially fulfil the council motion.
I think I've just got a quick question. I know others want to ask questions. It's really sitting very uncomfortable with me at the moment, the situation that we're at with the energy costs going up and pensioners going through winter. It just really worries me about the situation we're in. And I know it's only a small pot of money and there's lots of people that we need to help. I think that's indicative of the way the country is at the moment. In terms of, you were talking about that the money that we have allocated can help the elderly. Am I correct in my understanding it can only be those who are in receipt of pension credit can only get support? So is that correct?
No. So there are some conditions associated with some elements of the funding. So the discretionary welfare assistance scheme does have eligibility criteria attached to it.
Right.
However, this is very much crisis focused. So the allocation, particularly through the household support fund, we use very much more flexibly. So anybody presenting with a need we'd be able to assist. So it wouldn't preclude them from it, whether they're on pension credit or not.
Councillor Udall?
Just to plea first of all that we should potentially wait till after the budget before we can come to any determination on funding for pensioners after the winter fuel allowance decision, because I believe some changes may be occurring. I certainly hope so. But my question was on page 38, supermarket vouchers for children and college students. For the children who receive free school meals will get a £15 voucher. Last week I picked up some information that was in jeopardy for this Christmas. I hope that's not the case, and whether we can seek an assurance about that, and to see whether what resources will be available to support families with children over the Christmas holidays, because that is obviously going to cause a lot of stress and tension for them, especially with potential rises in fuel costs.
Yeah, so the free school meals programme is delivered by County Council. My understanding is that the proposal is to continue that through holiday periods. I've not heard anything to the otherwise, and that was certainly in the proposal that I saw. So we have mirrored the County Council scheme. So our scheme focuses on preschool age children and children that are still in education that would be eligible for free school meals. So it's sort of supplement and wrap around the core provision provided by County Council. Within this, you might see that we've earmarked enough funding to cover Easter next year. So although Easter falls outside of the time limits for which the grant can be allocated, we did have authorisation in previous tranches of the funding to be able to pre-allocate that funding to go just onto the next just beyond the deadline. So we've preempted that, so we should have enough funding to be able to continue that beyond into Easter next year, assuming that county also do that, and also we have enough funding available.
Councillor Denham.
Thank you. I've got a couple of questions and some comments to make as the person that was sort of heavily involved previously in these schemes. So just to clarify, so what is available within Worcester City between now and the end of March is the items in paragraph 2.6 and in paragraph 4.5, is that correct? So which would comes to a total of 288,543?
Correct, yeah.
Which is, compared to many of our neighbours, is actually really a very generous scheme and a level of available emergency funding that other councils are not necessarily providing to the same scale. The Household Support Fund 6, which is what is in paragraph 4.5 and which the new government has agreed. I mean, there was a couple of iterations ago of the Household Support Fund where there was some of it kind of earmarked for older people. And my recollection is that part of the money was ring-fenced for older people, and it wasn't necessarily being spent and being used. Whereas what we have now is, rather than ring-fencing to a demographic, is actually a provision for those in the most urgent need and struggling to the greatest extent with the cost of living. And with regard to pension credit, that is about criteria for eligibility for the winter fuel allowance. It's completely unrelated to being in emergency need. And I think it's a really important message that, no resident within Worcester City, if they're struggling with their council tax bill, if they're struggling to put food in the table, if they're struggling to pay their energy bills, they should come. Help is available, and there are a whole range of organisations where they can access that. So I really hope that is an important message for every resident in Worcester City, and not to kind of frighten people so they don't put the heating on when they do need the heating on, because we can help people. And my other question is actually about the new bit, the voluntary grants. Now, I understand it's a very short time scale. You don't want to sort of set up a whole new programme. I guess it's just kind of some assurance about kind of criteria or kind of equitable access to that, and who might be bidding for it, and to make sure actually that it reaches those most in need, who are not necessarily those that speak loudest.
Thank you. Yeah, I mean, on the first point, what I didn't add previously was the county council have adopted a universal approach to support as well in previous grant schemes. So they've provided post office vouchers for older people and those with the disabilities. So if they require sort of additional use additional fuel to use equipment and things, then that's been available, and they've applied that universally across the county, so that there isn't a sort of district sort of postcode lottery around that. The element that comes to district councils is generally being more focused towards the local demographics, the local needs, and what's already established within each of those district councils. In terms of the grants, I mean, yeah, we don't have much time at all to mobilise a sort of formal grants programme, so we're acutely aware we need to get that out the door as soon as possible so that it can be used as meaningfully as possible. We felt that focusing that in the period after Christmas would probably be the most useful, between Christmas and March, because there's often a lot of activities and goodwill around Christmas. So actually is an opportunity to, and often obviously people might be in greater hardship after Christmas. So we've got a bit of time to get that establishing in place. But exactly who that goes to and what that looks like is something we need to determine, but obviously make sure it's equitable and fair and available to people. We do have a challenge. I mean, there's £288,000 is considerable amount of money which is available, which is really positive, but it also presents a challenge to us to make sure that's reaching those that need it the most over the next 6 months.
Councillor Lawrenson.
Thank you, Chair. Again, some comments, and I'll conclude with a couple of questions. I think it's correct to suggest that the removal of the winter fuel payment is not related to the Household Support Fund. It clearly is. I mean, the request not to frighten people is on deaf ears. The people are already frightened, and they've been frightened by the current government. 2 questions. How do we currently inform the elderly people what support is available? And related to that, do we have staff that they can speak with in person or by telephone? The reason I ask that is because during the pandemic, when we weren't able to door knock, my colleague and I in St Stephen Ward telephoned residents to see how they were. And there were so many elderly people who did not have the internet. They were just cut off from society. So how do we inform them what household support is available to them? Do we have the staff to field their queries and help them navigate those various pots of money so that they can be supported? Because my concern is that whilst in this room we're talking about this support, a lot of people outside this room don't know it's there. So how are we getting the message across?
Yeah, I mean, we try and do as much promotion of the scheme as possible. So one of the best routes has been through working with our partner organisations, who are often best placed to do that. So Age UK typically have been a sort of really useful means of notifying certain residents. They'll have access to people, have the means of promoting things which certain demographics might look for and access. We're very conscious that just putting something on our website is not going to cut it. We have previously done sort of door knocks in localities which we knew would probably be less service, so not social housing providers, because often they've got housing officers and but actually like private rented accommodations. We targeted locations where we know may not be aware of what support's available. We've done sort of promotion in by Asda in Crown Gate, so that just people passing by we can share that information with. But it is a challenge for us. I think it's something that we need to be mindful of to make sure it is as widely publicised as possible, because we want people to access it and we want the people that need it the most, and often the people that need it the most are less well connected. Some of the things that Lloyd was talking about earlier through the district collaborative, tackling loneliness and isolations, how do we reach those people, how do we make them aware? So it's a challenge that we are aware of, and in terms of resourcing, we've got the Trinity Street Housing Advice Centre. This is buildings open, so we are a very open, accessible council generally, but also we benefit from our partners. So, you know, their points of access as well, and that they'll refer into our services.
Yeah, thank you, Tom. Through you, Chair, yeah. It wasn't a barbed question at all. It was a genuine question. So thank you. And I guess in addition to what you're doing, I would sort of make a plea to all councillors to use the newsletters, if indeed they produce newsletters, to maybe list, bullet point what support is available, just make it as obvious as possible. Because just to reiterate, I'm just worried that people are missing out. But yeah, thank you, that is reassuring. Thank you.
Do we have any other questions at all? Councillor Kimberley.
Thank you. I think it's really important that we welcome the fact that there are lots of people now engaging in the conversation about deprivation. You know, I work in an area where there is significant deprivation, and actually I think it's really important that we acknowledge the wide range of circumstances that we actually find on the ground in terms of the people who are really struggling with the cost of living crisis. My personal experience, just as someone who's been out and about in the ward talking to people, is that actually it's very often it's younger people and working people who are really bearing the brunt of the cost of living at the moment. And it's often people who are working or who have families who are struggling with managing their bills. I found it very interesting looking at the last report actually, and a couple of the reports attached to this, where it seems like a lot of the help that we're providing actually in practical terms goes into supplying better quality of white goods, which are more energy efficient, and also providing practical help with insulating boilers and things like that. Simple steps that will wind up having a long-term impact in terms of household finances. I wanted to just follow up very quickly on the question of the VCSE, which I think, if I can find the paragraph number, we're looking on the table on 4.5. And I was just going to ask which team is going to be responsible for administering those costs, and just to ask the hypothetical question based on what I have heard and wanting to understand the situation better. If we were losing members of the community engagement team, is that going to impact our ability to distribute funds like these in the future? Thank you.
Yeah, so in terms of distribution of the funding, that would be in combination with our housing and community services team. In terms of the reduction in community services staff, no, that shouldn't have any direct impact on the ability to distribute grant funding in the future. Subject to, you know, whatever the future may hold, but it wouldn't be directly through the officers going out and sort of dishing it out. So it would be a sort of a scheme administered from the office.
Thank you.
Any other questions? Okay, right, are we happy to note the content of the report and approve the allocation of the DWP Household Support Fund? Are we happy? Yep, great, okay, thank you very much. Moving on to any other business. Don't think there's any. Therefore, the meeting ends. Thank you all very much.